post, we're going to be talking about how we would run a person through an analysis when they come into the office and we're trying to figure out what's going on with an individual. In particular, you're probably watching this because you have some type of a chronic problem that no one has been able to help, and you're looking for answers. And our job is really to be a detective, to find the solutions so that we can increase and create health for you. So we want to compare what a functional analysis is versus mainstream medicine. Kind of bring you through a scenario of an individual coming in, a typical person. So we're going to call her a 45-year-old female, and she's experiencing fatigue. She's experiencing weight gain. She might be experiencing some perimenopausal symptoms. And she's under lots of stress. She's dealing with teenage kids, so she's got maybe some anxiety, insomnia. Pretty typical person, right? I see these every day in my practice. Now, medically, they may look at all these different symptoms and take care of them individually through some type of approach, through medications, etc. And the idea is they're looking at the symptoms. So some of the axioms of how I take care of people are that first, you treat the person and not the diagnosis. So you have to look not only at that symptom picture, but you look at their history. When you come in, we're having you fill out 18 pages or so of information from your past history to what you're eating, the exercise that you do, to the symptoms you're having, to the support structure in your life, the amount of stress in your life. You have to look at the whole person. So you treat the person and not the diagnosis. Second, you must realize that function is what determines health and not the presence or absence of symptoms. I have other posts on a difference between symptoms versus and diseases versus looking at someone's function to determine how healthy they are. And the other thing is that everything affects everything. There are connections between these things, and I want to try to bring you through some of them. So on the medical side, I'm talking about mainstream, they may look at all these things and say, well, you got to eat better, you got to maybe start exercising, which will help your stress. With the fatigue, if you're not sleeping, let's give you a sleeping pill, something that will aid you in your sleep. And why don't you start eating a little bit better? Okay, so they're going to medicate you, and they're just going to kind of go after the symptoms. Now, on our functional side, we're realizing, well, she's not sleeping, she's going to be fatigued. And with this lack of sleep, maybe she's lacking sleep because maybe there's an adrenal problem. In other words, her adrenal and her cortisol levels are not in good shape. So as a result, that keeps her up at night. Keeping her up at night is going to draw the fatigue. But because of the anxiety and the stress, it drives the adrenals to constantly pump out more problems. And the cortisol also will shift blood sugar. And the blood sugar helps, obviously, fuel the cells, but it's an influence from the cortisol. The cortisol helps drive blood sugar. And maybe as a result of the stress, maybe we want to look at the thyroid to determine, okay, is that related to any anxiety or depression symptoms that she's having, and determine how these things, now that these are off, is that producing the weight gain. In addition, we might sit down and realize, okay, if this person has lots of stress, there's a chance that the type of exercise that she should be doing shouldn't be a rigorous type. Maybe it should be yoga or Tai Chi. Maybe you want to get into some counseling on how we can have her manage her stress, some meditation practices. So the idea is we have the time to be the detective and not just treating each symptom with a medication, right? Give the person antidepressants. We're going to find out why. Maybe the anxiety is driven from the fact that she's got under so much stress, which pushes the cortisol, which is a stress hormone, which alters the blood sugar, which then produces high levels of insulin. And high levels of insulin is a fat-storing hormone, and then that drives the weight gain. So maybe you have to get into balancing the blood sugar, looking at the thyroid from a functional perspective, and then supporting that stress structure, and then counseling on exercise, appropriate diet, and not just telling the person you got to eat better. Maybe they're sensitive to food, and that's what's driving some of the inflammation that produces the anxiety also. There's a relationship between the gut and the brain, for instance. So you have to look at the whole person. You're looking at it as a systems approach, as opposed to looking at each symptom or the diseases that she may have, and they're just medicating them to just drop down the symptoms. Because just getting rid of the symptoms with the medication, although it may make the person feel better, it doesn't take care of the problem. So as a result, it's going to start manifesting itself down the road as other things that are more severe, and now that they've gone on a longer period of time, they're harder to take care of. So there's a difference between what is a functional approach, looking at how the person's functioning to get them healthier, versus just treating the symptoms. So I hope that helps. I hope it sees a little bit about what we're going to be trying to do when you come in as a patient. And in general, if you're watching this from a distance, maybe you need to find a doctor in your area that can also help you. And if you need that, please feel free to contact my office, and we'll be willing to maybe look for a doctor in your area that will approach you from this type of approach in your healthcare journey. So I'd like to thank you for watching, and make it a great day.